afternoon. My name is Danny. I'm a consultant here at 305 Plastic Surgery, and I have a surprise for you guys. I had already mentioned it earlier today. We have Dr. Sadio here with us today.
Hello, good to see you. Always good to be with you, Danny.
Welcome back to our live sessions. How are you feeling today, Doc?
Great. I'm having a great time.
We were talking a little bit about your celebration today, right?
Yes, it's hard to imagine. Since I've started at 305, today I've done 500 cases. 500 cases.
That's a lot. We were talking about that.
That's a lot. 500.
500. Así es. So Dr. Saudi is very happy and excited today. She hit her 500 cases since she first started with us. Dr. Saudi started with us back in January of this year, but you didn't go full on throttle until like February, correct? You were telling us.
Correct.
Okay.
Yeah. So I mean, it's hard to imagine, but we've just been. I mean, I don't try to do as many cases as possible. Like I just believe in steady. I like to be steady. I like to do my cases for the day, and I like to be attentive. I like to pay attention to patients. So for 500, with the kind of practice that my team has, I feel it really feels like an accomplishment to have that kind of volume with the attention that we give everybody.
All right, so for my ladies watching, if you guys happen to have any specific questions for Dr. Sadio, we will be going over them right in this live session. Take advantage of having the doctor here with you to ask all the questions you guys may have, specifically medical questions, because you guys know I'm on these lives every day, but I'm not a doctor. So let's take advantage of Dr. Sadio being here to answer all your questions and concerns. Carolina, I have a patient in Spanish, so I'm going to read it in Spanish, and then we're going to go ahead and answer in English, and then I'll just do the translation, right?
Perfect.
So, Carolina, voy a hacerle la pregunta a la doctora Sadio en español para entonces que ella me dé tu respuesta y yo te lo voy a traducir. So the patient is asking, hi, I would like to know if a lipo 360 would help eliminate or improve fibrosis in the abdominal area, and if it's possible to do lipo 360 with J-plasma.
Okay, so she's asking about lipo 360 for fibrosis. She has fibrosis.
Right, so she kind of, from what I'm seeing, she kind of wants a second round of lipo to improve possibly the fibrosis, and seeing the possibility if maybe J-plasma could help her improve the fibrosis.
Yeah, excellent question. So yes, a redo procedure, second round as we say in the business, is perfect for lumps and bumps and areas where that first time, the contours either weren't perfect. I don't know, where she got her first procedure done, or sometimes patients just gain weight. They gain weight, and then they gain weight in odd places, and so we can take care of that. So yes, the second time is going to be a little bit more difficult. There's going to be scar tissue. It's never like the very first time, just fresh kind of virgin fat. But that is no reason not to go ahead. I do a lot of corrective lipo. In fact, I really enjoy those procedures because they're creative and they involve, it's another part of my brain that gets stimulated when I do those. So the answer is yes. The other thing about a redo is it allows us to kind of redrape. Sometimes it's not so much that you have fat, but that you have stuck down areas.
Yep.
So that second round isn't so much a debulking procedure. It's not so much getting fat out as it is redraping the skin. Mm-hmm. So it's very helpful for that as well. And J-plasma, sure, that's going to help with tightening. Mm-hmm. You're going to get at least 20% improvement in tightening with J-plasma versus without. So I think I haven't seen her, but the way she's thinking, I like the way she's thinking about her procedure.
Yep. So, Caro, te cuento que la doctora te dice que claro que sí puedes hacerte una lipo 360 e incluso incluir el J-plasma para mejorar el área de la fibrosis. So, lo que pasa, lo que ella explicaba es que a veces cuando se hace la primera lipo, normalmente pueda que quede de pronto algunos desniveles en las áreas donde se hizo la liposucción la primera vez. So, la segunda vez sería para corregir lo que de pronto no te gustó de la primera vez, ya sea el contorno que te dieron o en este caso que lo que quieres es ayudar a eliminar la fibrosis. Entonces, claro que sí se puede mejorar por medio de una segunda ronda de lipo e incluso si deseas agregar el J-plasma también lo puedes hacer para que puedas experimentar un poquito más de ver la piel un poquito más tensa. Y de verdad que es un gran combo. De hecho, tenemos una promoción en este momento donde te vamos a incluir el J-Plasma totalmente gratis, porque típicamente tiene un costo de 2.500, pero con los paquetes que tenemos disponibles te va a salir totalmente gratis. Así que ahí está tu respuesta. Doc, we have a lot of patients right now. Breast procedures are really in for some reason. I've seen a huge change and shift with patients wanting to book breast procedures, and we know that you're very popular for that.
I love breast. We talked about this last time. I wasn't doing much breast before I came here, and I was asked to do breast, and I said, you know what, it's in my training. I haven't done those cases in a while, but I've gotten so into it. It's really been fun, and I'm enjoying the results and enjoying the patients. Breast surgery is so personal. It's really so much of what makes a woman feel feminine, and it makes a woman enjoy her body, like as a woman. There's so much to that. Clothes, how you feel in clothes and look in clothes, cleavage, bathing suits. There's so much that psychologically to breast with breast surgery. So I'm really enjoying that. Just the craft of it, and then there's a kind of intellectual component, a psychological component I've been enjoying. So yeah, and you're right. I don't know what's your explanation. Why do you think there's this resurgence?
I feel like maybe I just feel like everyone was coming in for lipo and for lipo BBLs and for tummy tucks and sometimes for mommy makeovers. But I honestly feel like since you arrived at 305 Plastic Surgery, we've seen a huge boost on breast procedures. Yes, 100%.
Interesting.
With both like Hispanic patients and our regular American patients, even patients. We got a patient come from Italy as well.
Yes, I remember her.
So definitely we've seen a huge boost with breast procedures now that you're here.
Oh, I love it.
And now that you were explaining like, the cleavage, the bathing suit, do you feel like maybe you being a woman, that makes you more understanding of sense?
Yeah, I think so. I do think that there's an aspect of that. My male colleagues are amazing here at 305. So let me just start by saying that. And I love the people I work with here, my other surgeons. But I do think that, inhabiting the female form and understanding, especially wardrobe, wanting to feel a certain way in your clothes, and also identity. And I'll talk about a patient I had today. So she had very large implants put in, 600s, in her 20s. And she loved it. She enjoyed that look, and that was what kind of what she wanted for the time. And now it's 15 years later, and she married someone very religious, and she became more religious, and also she wants to start to play sports. She wants to go to the golf club and the tennis club, and she just wants. It's just a very different feel. Now, does that to say that large-breasted women don't play golf and tennis, or that small-breasted women are not, looking all, hot and amazing? No, but she wanted that. She wanted a different. She wanted to inhabit her body in a different way, and the breasts were going to make a significant difference. So we did that procedure today, and I just know she's going to love it. I just know it's going to just be such a change for the way she lives her life. And I don't think men have that. You know what I mean? You can get some, you can kind of buff up. They can lose a lot of weight, or they can go to the gym and get sporty. But there's something about breasts and clothes, and it's just different. So I'm enjoying it.
And that specific patient, you were explaining she had very large implants, and now she wanted smaller implants because things change over time and things like that. So what specific procedure did that patient get done?
Good question. So obviously those implants stretched her skin quite a bit, and then the pocket, which is the place we placed the in her case the implant was placed under the muscle, which is my preference in general. There are a few cases where I would say over the muscle, but for the most part, 90% of my operations are under the muscle. So the pocket got stretched out. So we need to address the skin. So what did she have? She had an implant exchange, right? So for the large implants just to a smaller implant. And we had to do a mastopexy. People think of a mastopexy as a lift. It's called, in common parlance, that would be called a breast lift. What is a breast lift? Is a breast lift just lifting the breasts? No. In this case, we had to tailor the skin because she had so much loose, redundant skin. We had to tailor that skin to fit a smaller implant, to be a smaller size. So I was trying to figure out a way to explain the procedure, and this came to me a couple weeks ago. It's like you're making a bra out of your own skin.
Yeah.
That's what it is, right? So it's not just lifting everything, because of course we're going to make an implant will make you perky, will make you bigger, but a lift is re-tailoring and refashioning the skin in a way that creates lift.
Yep. That's amazing. And I feel like that's a very common question that we get from patients, like, oh yeah, I want to exchange my implant, but it's not just exchanging, it's what do you want to exchange it to?
Exactly.
Do you want the same size? Do you want a bigger size? Are you thinking about a smaller size? Para las que me están viendo, que sé que tengo muchísimas en español, de hecho tenemos a Kerry conectada acá. Ya, Kerry, vamos a ver cómo te mandamos para que te puedas unir a la transmisión y que puedas hablar con la doctora Sadio. Por aquí veo que tengo una paciente que dice que tiene fecha con la doctora el día 23 de octubre, que se va a hacer una lipo 360 con J-plasma, levantamiento de senos, que espera que la dejen hermosa. Ya te voy a traducir todo para la doctora Sadio. ¿Cuántos masajes recomienda cuando se hacen una lipo BBL? Normalmente siempre la recomendación debe ser de 10 a 12 masajes como mínimo, pero entre más masajes te hagas, mejores resultados vas a obtener y más vas a prevenir la fibrosis. Game, ya le voy a decir a la doctora tu comentario para que ella esté al tanto. Y Kerry, obviamente ya estamos resolviendo a ver de qué manera te vamos a ingresar. Para las que me ven en español, ahora mismo la doctora estaba hablando más o menos de que hoy casualmente, número 1, llegó a sus 500 casos desde que empezó con nosotros. Ella empezó en el mes de... Empezó en enero, pero full empezó en febrero. Y ya hoy llegó a sus 500 casos. De hecho, 501.
501, yeah.
501. Y hablaba de que tuvo un caso muy peculiar el día de hoy de una paciente que tenía bastantes senos, tenía unos implantes bastante grandes y quería un implante un poco más pequeño. Y ahora le vamos a dar la explicación de cómo fue ese procedimiento el día de hoy, así que no se pueden ir. Y por acá tengo a Kerry. Doc, this is actually a patient who's been dying to speak to you.
Okay.
She's right over here. I think she speaks only Spanish.
Okay.
But I'll be translating for you.
Okay, good. Good to see you.
Kerry, saluda por allá a la cámara.
Okay. Hi. Hola. Okay. No hablo mucho español, pero entiendo más que hablo.
Kerry, ¿qué tienes para decirle a la doctora?
Okay. So what's her question?
Ya quiero ver sus resultados, cómo me va a dejar. Quiero que me deje súper hermosa.
Oh.
She says she's excited and she wants you to leave her super beautiful.
Que fue la doctora que trabajo que me deje súper hermoso. Ahorita para el 30 tengo mi cirugía.
Okay.
Y bueno.
She's having surgery on the 30th of this month.
What is she having done?
Kerry, ¿qué te vas a hacer?
Me voy a hacer una lipo 360 con BBL y papada.
Lipo 360, BBL, and chin lipo.
Oh, okay, good, exciting. So when is her procedure? When is she coming?
She's having it on the 30th of this month.
30th this month. Okay, great.
Kerry, el 30 de este mes, ¿verdad?
Sí, de octubre.
Pero yo te noto nerviosa. Yo creo que tú tenías muchas más preguntas para la doctora.
Sí, estoy un poco nerviosa por la anestesia y lo que tengo para decirles es que quiero que me deje súper hermosa.
Okay, she's nervous about
que yo quede
Espérate ahí para traducirle.
sorprendida.
She's nervous about
two
anesthesia.
things. She's number 1, she's nervous about the anesthesia, and number 2, she just wants you to leave her absolutely beautiful.
Okay, well, number 2, the second question, don't you worry about that. Okay, I take so much time and care and attention to making sure that you get the best result. I am obsessive. I am compulsive. I want to make sure that the curves are what you want. Also, I spend a lot of time in pre-op because everyone's not the same. It's not everybody just. There's no cookie cutter here. I spend a lot of time talking to every patient about what they want. And I had a patient come tell me, and she said, "I came to you because I heard you give me what you give me what I want. You give patients what they want." And I think that's true. I'll say that. I take a lot of time with that. Anesthesia, no need to worry. I have a very special team. Okay, I have hand selected my team, and my anesthetist is very, very competent. I have a team. I have a team of a few, and my anesthetists are the best. They have done thousands and thousands and thousands of cases. That's literally thousands of cases, and I would never trust my patients with just anyone. So you can be assured that you are in such great hands.
Katie, te voy a traducir todo lo que te dijo, ¿ok?
Ok.
Bueno, primero te está diciendo de que no te tienes ni que preocupar por absolutamente nada, que vas a quedar absolutamente hermosa. Ella te decía que ella es muy detallista con sus pacientes y de que ella de verdad se toma el tiempo de explicarle a cada paciente cada cosita mínima, hasta la mayor, hasta la más chiquitica, hasta la mediana. Eso, en cuanto a tus resultados, vas a quedar totalmente hermosa, de eso no vas a tener ninguna duda. Decía ella también que ella le dedica su tiempo a sus pacientes y que para ella es súper importante el preoperatorio, que es realmente la oportunidad donde tú tienes la oportunidad que tú tienes de hablar con ella y de realmente explicarle, doctora, esto es lo que yo quiero, así es que yo quiero lucir, tráete una fotico contigo de algo, de un cuerpo que tú hayas visto, así sea en Instagram, donde sea, y se lo muestras y le dices, doctora, esto es lo que yo quiero. Y en cuanto a la anestesia, te estaba diciendo la doctora de que ella seleccionó su equipo pues su equipo de anestesia, ella misma lo escogió. So, las personas que ella tiene para su anestesia son personas totalmente competentes para llevar el caso, así que por eso tampoco te vas a tener que preocupar.
Ok, muchas gracias. Y que me disculpe, ella me mandó a decir con una de las coordinadoras que si podía operarme ahorita en septiembre, pero no pude porque tengo que terminar mis cosas acá y todo, entonces que me disculpe.
No, mami, tranquila, nada de disculparse. Aquí todo está bien, todo está perfecto y nosotros súper felices de que te vamos a tener aquí muy pronto.
Bueno, muchas gracias por unirme y fue un placer.
She says thank you, and she says nice to meet you,
Nice to meet
and that
you.
she'll see you soon.
Can't wait to meet you in person, okay? See you. Take care of yourself.
Que te cuides mucho, Kerry. Ay, mira para mí la cara, salí yo así.
Igualmente, que se cuiden mucho y ya nos vemos el 29.
Claro que sí, mi amor. Un besito, te veo cuando vengas.
Okay. Mwah. Bye.
Bye.
Oh, that's a treat.
So sweet. Okay. So, bueno, esta vez te lo dejo aquí. Okay, perfecto. So, how is that? How do you feel when you interact with your patients like that?
It's so fun. It's so fun. It's funny because the patients have an advantage, right? Because they've seen me. Right,
Yeah.
so when I walk in, it's like they know me, and I'm meeting them not usually for the first time because we do a lot of consultations, but it's great. I just love the job because of all the people, all the great women that I meet, and men. I take care of men too, but the vast majority of my patients, I just meet so many great patients, and lately. Because after now that I've been here a little while, now I'm seeing. Oh, you did my sister last week. Oh, you did my
We're
cousin.
actually having comments on that.
I had a husband and wife. I had a fiance. The male fiance, the guy was yesterday, and then his fiance was 2 months ago. I get mothers and daughters, office friends. I mean, it's so fun. It's so fun. I love it.
I love when they come together.
I love it.
I'm going to read some of the questions. Shiley is scheduled with you for November 4th for Chin Lipo, Lipo 360, and BBL. She says that she can't wait to meet you.
Yay, exciting. Exciting.
Do you like Lipo BBL? Is that what
I do. Lipo BBL is great because it's the shape, creating the shape. There's nothing more satisfying than creating a waist where there wasn't one.
Yeah.
Getting rid of some big square flanks that are just sitting there, taking up space, and the art of and magic of fat grafting is, before, the BBL, people, I don't know if people realize, but the Brazilian butt lift came out, I mean, it was out of Brazil, and it came out of this feeling that the surgeons were doing lipo, and they had this raw material, and they were throwing it out.
Yeah.
And the idea, and someone said, "Hey, why don't we use this? Like, what, we can, instead of just creating negative space by kind of carving and when I say carving, I mean kind of sculpting. Right? With the cannulas and with lipo, we can actually build. We can build out. We can use this material, and so I just think it's exciting. It's a really fun procedure to be able to sculpt a human form that way.
Yeah, I feel like that's one of my favorite procedures, the lipo BBL. I feel like that's one of the procedures that gives patients the most dramatic change. And it's also one of the procedures that it's always best to start off with. Like, even if you want a tummy tuck and you're not sure about having the tummy tuck right away, you can always start with a lipo or a lipo BBL, right?
Yeah, exactly. It's a great place to start. It's a great place to kind of to decide if that's for you. I think it's just fun.
We have Jenny over here saying, Dr. Saudio is the best. Please let Dr. Saudio know my sister is coming to her in 2 weeks. Jenny, did you happen to have surgery with Dr. Saudio before? Do you know her? Tell us about you. And did you refer your sister to us? What's up with that? We have another one over here. Luzan, tengo cita para el 12 de enero, pero es con otro cirujano. Luzan, no te preocupes. Acá somos la clínica más grande de la ciudad de Miami, de hecho del estado de la Florida. So, si quieres hacer algún cambio, siempre es a nivel personal, pero siempre vamos a preferir que te quedes con tu doctor de preferencia, que fue el primero que escogiste. Sin embargo, como la doctora Saudio, obviamente es la doctora, puedes preguntarle cualquier tipo de pregunta médica que tengas para ella. Ramírez Jessic dice, hola, vivo en Tennessee, me imagino que es. Quisiera saber si tienen hospedaje y si me pueden dar más o menos en cuánto me sale. Me quiero hacer una 360, pero soy muy caderona y me quiero quitar pierna y cadera. Ok, so en tu caso, mi amor, puedes hacerte una de las promociones que tenemos disponible en este momento, donde te vamos a regalar 2 áreas de lipo y solamente vas a tener que pagar $2,500, que va a ser el valor completo de tu paquete. Te vamos a hacer lipo 360, te vamos a regalar 2 áreas de lipo, te vamos a regalar una faja totalmente gratis y aparte te vamos a regalar el J-Plasma. Nosotros somos clínica de cirugía plástica, lo que quiere decir que no te vas a quedar aquí con nosotros ni vamos a estar hospitalizándote. Tienes que buscar dónde te vas a quedar, sea en la casa de una amistad, en un hotel, en un Airbnb o incluso en una casa de recuperación. Dr. Saudio, they're asking about where you're from. They're asking, is Dr. Saudio Jamaican?
Yes, I am. Yes. So I was born in Jamaica, and I have to give the proverbial shout out to my family in St. Kitts and Nevis. So my dad's family is from Nevis, which is a very small island in the Caribbean. If I don't acknowledge that side, I'll get into trouble. But I was born in Jamaica, so I'm of the islands. And then we came to the U.S. when I was very small. I was 3 years old, so my dad could go to grad school, and so I grew up in the Northeast. I grew up in the New York area, New Jersey. And trained all over. I trained in Northeast, but now I'm in Miami, and I'm loving it here.
You love it?
I do love it here. This was a good move for me. It was the right time. It was the right time to do something new, and I feel like I'm closer to my roots here, even though it's not the islands. Like there's a kind of there's a vibe here.
I love it.
That I'm enjoying. And I have so many Jamaican patients.
You do?
Yeah, I'm getting a lot of and patients from the islands. I've had Bahamas, Jamaica.
Yeah, we have a lot of patients from Bahamas.
Yeah, Bahamas, Jamaica, and Barbados I had the other day. So I'm developing
Trinidad. We're also getting patients from Trinidad.
Yep. Because I think there are a lot of people in the Caribbean want the U.S. They want to go to the U.S. for and have maybe a U.S. doctor, but they don't want to necessarily go to New York. Mm-hmm. Miami makes sense. It's it's proximal, and come see me because you'll get the the whole experience.
Okay. Orbi, estoy leyendo tu mensaje. De hecho, leí tu mensaje anteriormente donde me decías que estabas esperando una llamadita. Sin embargo, no sé si tu caso fue asignado directamente a mí. Probablemente si fue, debes tener un mensajito de texto de mi parte donde dice: hola, soy Dani, te estoy llamando de 305 Plastic Surgery, no me pude contactar contigo, o algún tipo de mensaje que tenga mi nombre. Si no tienes un mensaje que tenga mi nombre, probablemente no asignaron tu caso bajo mi nombre. So, puedes tener alguna otra consultante que te debe estar intentando contactar. Recuerda que si quieres que yo te ayude directamente, tienes que dejar un mensajito por privado diciendo: mira, yo quiero que Dani me atienda, para que te puedan asignar tu caso a mí directamente. Gaza Queen Shorty is saying, I'm coming to Dr. Sadio in February. Just like to know if she is Jamaican. Of course.
Yes,
we just talked about it
we
now.
just talked about it. It's so funny. It's like so interesting how the word gets out like that. So, yeah.
Gámez dice: por favor, dale mi mensaje. Me opero con ella el 23 de octubre. Me hago el lipo 360 con transferencia de glúteos, J-plasma, papada, brazos, levantamiento de senos con silicona. Dile que estoy muy nerviosa. Espero que me deje hermosa. Aquí voy a traducirle tu mensaje para que ella sepa. So, we have someone over here. She says, please give Dr. Sadio my message. I'm having surgery with her October 31st. I'm having lipo 360, BBL, J-plasma, chin lipo, arm lipo, breast lift, silicone implants, and she says she's very nervous.
Okay, all right. Actually, it sounds like a lot. That's actually not a lot. That's just a combo. That's basically just, she's having a BBL also?
Yeah, just lipo BBL with 2 extra areas.
Yeah, and then
J-plasma and the breast.
And then the breast. Yeah, I mean that's a simple combo. Yeah, so we're gonna take great care of you. I mean the key thing is you're gonna have to figure out with the breasts and the BBL. Just be prepared in terms of how you're gonna get all the accessories. Get the mattress, the BBL mattress. Get the pillow, so that you can make sure that when you get home, you're in a good.
Just comfortable.
You're comfortable and you can protect your grafts.
Yep.
But I'm here for you, waiting for you, and cannot wait to give you that look that you want.
Mi amor, te dice la doctora que ni te preocupes, que todo va a estar súper bien. Realmente vas a tener 2 cirugías grandes, que serían los senos y la lipo BBL. Todo lo demás serían como cositas extra o áreas extra. Solo tienes que estar nerviosa, estás en las mejores manos. De hecho, la doctora Sadio estaba hablando ahorita que ella misma escogió su equipo de anestesia, su equipo médico y todo el mundo que la acompaña, así que estás en las mejores manos posibles. Claro que vas a quedar hermosa. Ella me decía que lo más importante es que te prepares antes de la cirugía, que te asegures que estás siguiendo las instrucciones, pero que también te asegures de que tengas todo listo para cuando regreses a casa te sientas cómoda. ¿Cómo qué? Como por ejemplo comprar el colchón que trae el huequito en la mitad, para que cuando te vayas a dormir o a acostar no vayas a de pronto dañar la forma del glúteo. Y como te vas a hacer los senos también, recuerda que no puedes dormir de frente. Entonces o te va a tocar ponerte almohadillas y crear como una barrera, o lo ideal sería que te compraras el colchón, que lo puedes conseguir en Amazon, y en ese colchón vas a poder dormir y te vas a sentir mucho más cómoda para pasar tu proceso de recuperación. Voy a hacerle un par de preguntitas a la doctora en inglés y luego las voy a traducir a el español. Entonces, Doc, I wanted to ask you, how can a patient prepare properly prior to surgery? Like, what are the big do's and don'ts?
Do's and don'ts. Okay, so don't. Sometimes people say, "Oh, should I lose weight?" Okay, in general, yes. I would say, before if you're preparing to have surgery, you should, you want to be your optimal weight. But once you're booked and once you're within a couple of like say months of surgery, just eat a balanced, healthy, normal diet. Just eat well, get good. Make sure you get your protein going, because you need to be able to heal. Your body needs those proteins, those building blocks to heal. It's not the time to go to try some new vegan diet. If you're already vegan and you have your protein sorted out, that's great. But it's not the time to go off the reservation, try anything new. Just stick with the stuff that your mom told you. Eat well. Prepare for afterwards. I find that like most of the patients here, what are they asking about? They're nervous about anesthesia. Yep. Everyone's focused on game day. It's probably a little bit like having a baby. Everyone's so focused on game day, but then what about the weeks and months afterwards? And really, most of the surgery is after you leave. So those immediate days, have somewhere where you are going to be well taken care of, a solid recovery house, or if you have a friend or family member who can care for you. Great care. Get your massages. Book your massages. The massages are important. I don't think there's any data per se about the massages, but we just know they work.
Yep.
We just know that the patients who are on it with the massages and do more massages, they just have better results. Yep. Prep your massages, have your plan together. I would say that's it. Gather your materials, like if you get your BBL pillow, get your mattress. Envision your day. How am I going to go through your entire day and figure out how you're going to go through your days. For example, with your BBL, how are you going to accommodate not sitting? Buy your arnica tablets. Buy your arnica gel. Mm-hmm. I'm surprised at the number of patients post-op who say this is the first time they're hearing about arnica. Arnica tablets, arnica gel, pineapples, if you like those. So preparation.
What are the benefits of pineapple post-op?
Pineapples have bromelain, which is great for bruising.
Oh.
So pineapples are excellent for post-op for bruising.
Nice.
So if you like pineapples, pineapple juice, have those materials ready. So you're thinking about the time leading up to the procedure, of course, but think about those first days and months and get ready.
So, le preguntaba yo a la doctora que cuál sería como que una manera de prepararnos para la cirugía, ¿verdad? Y entonces ella me hablaba de que no solamente es prepararte antes de la cirugía, que dejes de hacer esto, que dejes de hacer lo otro, sino más bien prepararte para lo que va a ser tu recuperación, que es lo que realmente te va a garantizar tus resultados. Entonces la doctora nos habla de recomendaciones como por ejemplo que compren el colchón que pueden encontrar en Amazon. Si lo necesitan, yo les puedo enviar el link para que se sientan mucho más cómodas a la hora de descansar y que no vayan a dañar la forma del glúteo. Número 2, ella decía que muchos pacientes de ella no tienen ni idea de las pastillas de árnica o de las cremas de árnica, que es algo sumamente importante para el proceso de recuperación, porque con eso vas a ayudar muchísimo a lo que es los moretones que te van a salir después. Hablaba ella también de los beneficios de la piña, para que coman piña o tomen jugo de piña o algo que contenga piña, porque la piña tiene un componente, explicaba la doctora, que te ayuda muchísimo a también bajar los moretones. Y simplemente que no piensen tanto, la cirugía, sino, ok, ¿cómo yo voy a cuidar de mi cirugía? ¿Cómo yo me voy a recuperar? ¿Cómo voy a hacer que estos resultados sean óptimos? ¿Por qué? Porque yo siempre se los digo a ustedes en los en vivo. El doctor o la doctora va a hacer el 50% del trabajo. El otro 50% lo hacen ustedes como pacientes, haciéndose sus masajes, que es súper importante, poniéndose su faja adecuadamente en los tiempos que sea posible, porque la recuperación no son 2 semanas. El cuerpo toma aproximadamente 3 meses en deshincharse completamente para que puedan ver los resultados finales. Así que enfocarse en prepararse antes, en prepararse durante, pero también tener la preparación para el después. Jessica, ¿a qué WhatsApp me puedo comunicar para una asesoría? ¿Qué precios para lo que estaría necesitando? Mi amor, lo único que tienes que hacer es mandarme un mensajito por Instagram, por mensaje directo. Me dejas saber, mira, yo estaba en el en vivo, estoy interesada, para poder ayudarte y hacerte una consulta. Si te gusta la doctora Sadio, claro que lo podemos hacer con ella sin ningún tipo de problema. La lipo 360 con el BBL, mi amor, está en tan solo $3,500, pero te viene con un paquete fenomenal donde te vamos a estar incluyendo muchísimas cosas totalmente gratis. Si a ti te interesa saber los paquetes disponibles de la doctora Sadio, de la super promoción que ella tiene en este momento, nomás tienen que mandarme un mensajito por privado para poderlos ayudar. Se les va a asignar una consultante y de esa manera se va a hacer la evaluación con la doctora. Las evaluaciones son totalmente gratis y los precios que tenemos en este momento también están increíbles. Doc, anything else you'd like to add on to our live? Tips, tricks?
You know what? I'm going to just talk about the time of year. I think that sometimes, I think right now, for me, don't you feel like September is like the new year, right? Because from school times, right? You kind of feel like, I don't know, I always feel like this time of year just makes me feel like fresh and new, and it's like always like it's a turning over of a new year. I guess just because I spent 100 years in school, maybe that's why I feel that way. But most people, I think a lot of people sometimes are focused on the new year. But I would encourage patients to use this time. I think it's a great time to have a procedure so that you can go into the new year
with a new body.
kind of already with that head start. I like to kind of get a kickstart on my New Year's resolutions. I actually start my resolutions like in the next, around like October, November. So I'm going into the year with momentum. And so I just like to encourage patients to think about, my schedule is pretty full, but I just want to encourage patients to think about that.
And I feel like also for this time of the year, fall coming into winter, it's much more comfortable rather than doing like summertime where you have to wear your faja and you're sweating and it's ugh. So it's all, I personally love to have surgery or my patients to have surgery along this time of the year.
Yeah.
It's coming into the holidays. You get several days off work.
Exactly.
It's more easy. So now would be an ideal time for you guys to have a consultation and to take advantage of the promotions that we're currently running because they're not going to be here forever. They're actually only for the month of October, November, and December. And for next year, we're having totally something different. But if you really want to save money and you want to get all the free accessories we're currently offering our patients, it would be ideal for you to plan this in October, September, or October, September. What am I saying? October, November, December.
October, November. Yeah.
We also have financing options for all of our patients. So if you are a little bit iffy about having surgery because maybe the funds are not there, you got a lot of things going on, holidays are coming up, that's totally okay. We finance your deposit and we also finance your procedure. Plus your consultation is totally free. So you can literally have everything done with having to pay $0 out of pocket and only start paying after you actually have your surgery done. So if you guys are interested in that, just let me know and I can give you that information. I think for now, Doc, we are all set.
Okay. Yes, we are. I always love these with you. We always have so much fun together.
Nothing. Thank you, Doc, for being here. I do hope we can do one of these at least once a week.
Yeah.
Patients love it.
I love it too.
Bunch of comments, people coming in pretty soon. There's another patient coming in 6 months. Carrie, who was the one that did the live with us just a few minutes ago, she's coming on the 29th. So I'm very happy that everyone loves you. I personally love you as well. I always talk about Dr. Sadio. I love her. And thank you for being here with us today.
Thanks for having me.
This is it for now, and I'll be seeing you guys tomorrow around 12 p.m.
Okay, bye.